We've had a number of inquiries about telehealth consultations. There have been webinars elsewhere about them. We thought we'd try and run through one example of how to do telehealth consultations here. Claire's been looking into it in some detail, and with a certain degree of trepidation, she's going to put herself out there now to hopefully give you a few pointers and illustrate a few pitfalls in the process of running a telehealth consultation. Over to you, Claire.
Okay. So, hi everybody. Hi Stephen. Oh, I can't see you. Gosh, maybe I've got this wrong. Hold on a second. Yeah. Okay. There we go. Right. Great, Stephen. Hi. Oh, now that's interesting. I can only see your eyes, Stephen. Would you be able to move a bit further away from the camera, or yeah.
Oh, can you hear me?
Yeah, I can hear you. Yeah, can you hear me?
Oh, right, okay. Hi, nice to see you, Claire. You all right?
Yeah, fine. Yeah.
Nice dressing gown.
Yeah, thanks. And yeah, good, nice glass of wine here. And
anyway, I've hurt my shoulder just here.
Have you? What do you think's wrong with it, Stephen? What do you think's wrong with it?
Well, I don't know. That's why I'm doing my telehealth consultation. I've hurt my shoulder, and it goes from here to here, and sometimes it hurts down here as well. And basically, I was doing some gardening the other day and a bit of DIY around the house, and I kind of lifted a wheelbarrow, and it just sort of, I don't know, it just, you know how it is, it tweaks, and now it's all over this area, and you know, it's just shoulder stuff, really. I think I've definitely pulled a muscle.
Okay, all right. So if you've pulled a muscle, we can probably sort that out. And have you got anybody else in the room with you?
Do I need someone?
Well, if you've got somebody else in the room with you, because obviously it's important that they hear, because I'm going to ask you a lot of questions about your general health and your poo and your pee and things like that. So it's important that they get to hear that as well. So
no, there's no one else in the room, Claire.
Oh, okay, all right. Well, that's so if you've pulled a muscle, that's good. What we could do is you could. Oh, hang on, I'll just get some equipment. Hold on a second. Oh, hang on a sec. The dog wants to come in. Hold on. Oh, Badger, for goodness sake. No, don't roll in the poo. Oh, God. Oh, do you have a dog? No?
Not with me, no.
No, okay. Right, so you probably need to get yourself a weight, you know, like this. And then if you've pulled a muscle, probably the best thing is, you know, just to do a few exercises like this and then ice it, I would say. And then if that doesn't work, well, you could go for an MRI scan. I think that sounds like that's probably about all we need to cover.
Hang on, really. I've got a telephone call coming through, Claire.
Yeah, okay.
Shall we stop this?
Shall we start again? Do you think anyone will believe us that you didn't know?
The people have been signing off in their droves because they think you're totally incompetent.
Okay.
I'm going to adjust my camera position.
You adjust your camera position, and I might adjust my socks. I might put my glass of wine down. I might actually take my dressing gown off. Right. Okay. You hold the show for a second.
Oh, right. Okay. I think the point we're trying to make there is that it's very easy for people who are new to Zoom to get it wrong, particularly your patients who won't be perhaps as used to it as we in our world are. And it's confusing. You don't know where all the buttons are. Someone invites you to a meeting. You don't know how to get the right picture on your screen. And it's very easy not to pay much attention to your own camera, which is very often looking up your nose or down your cleavage or whatever else. Is that fair, Claire?
Yeah, I guess the point, exactly that. I wanted to make the point that you can't control what the patient's background looks like or how they've positioned themselves, but you can control your own background. Think about what you've got behind you. Think about, have you closed the door so that the dogs and the children can't come and interrupt you? And think about how you're positioned in the camera. So many people, when they're doing Zoom calls, do this and then talk like that. And think about positioning yourself. So there's a little bit of room above your head and they can kind of see a bit of your arms. I think it's really important to do that. That means that once you get started, you know that you can then concentrate on positioning the patient. The other thing to do when you start is, where do you put the actual...
That didn't go on cue, did it really?
No, I asked my dad to phone me for exactly that reason, to interrupt us. So I'm currently looking at the picture of Stephen. So when you're setting up one of these calls, make sure that you've got the picture of your patient up at the top of your screen so that you're talking up towards the camera. And if necessary, shrink the picture a bit. So if I make the picture of Stephen really big, his nose, if I'm looking deep into his eyes, you can't see me looking at you. So if you make the picture a bit smaller up towards the top of your screen, it looks like you're looking at the patient. And let's face it, that's how we interact with our lovely patients. So the other thing I didn't do was to do an ID check. So I didn't check your name, your date of birth, and your address, which, if you know the patient really, really well.
Hang on, you know my date of birth. It's the same as our wedding anniversary.
It's got numbers in it. I've got no idea. So
but that's the point, isn't it? You know my date of birth, and of course that seems obvious here. But for all those patients on our list, we don't recognise them instantly necessarily, and we don't know their full detail.
Yeah, and again, a lot of what I'm going to say about this is about documenting it. So when you've checked date of birth and address and the patient's name, document ID checked. And if you're taking notes on a computer, try and make the picture of the patient a little bit smaller and at the top of the screen, and then you can put your notes underneath and still type. If you're using paper, obviously that's different. Yeah, so, and the whole business of consent. Ask somebody if they've got somebody else in the room. This is one of the things that came up in the UCO training, and I really, really recommend you do that webinar. They've got loads of really useful information in there. And one of their ones was that you need to make sure you get some kind of informed consent, particularly if you think there might be somebody else in the room. So say to them, is there anybody else in the room? Do you want to close the door? Are you happy to discuss health issues in front of that patient? And again, if you can think of an abbreviation, document it with an abbreviation. Obviously, I did no assessment whatsoever. So if you've hurt your shoulder, Stephen, to do your assessment via video, to me, this is the time where all our osteopathic and chiropractic training comes into its own. We were taught to think out of the box. We were taught to, when we're making our diagnosis, to scan, and just think about everything, think about how the whole body works, and then condense that into our diagnosis. When it comes to doing an assessment online, my thinking is, think about what you want to achieve rather than our process that we would normally do to get where we want to go. Because if you think about where you want to get to, then you can start coming up with inventive and creative and out of the box ideas about how to get there. So if you've hurt your shoulder, Stephen, could you touch where it's painful?
Well, it's all around here, really.
Okay. And is there a particular area that's more painful if you touch it?
If I poke it round about here, it's quite sore, yeah.
Okay.
Claire, would you get someone to take their shirt off for this, wouldn't you?
Yeah.
I'm not going to, because my microphone is tied into it, so.
Okay. So what I would say is, Stephen, could you start touching your arm about there, quite firm pressure, and then bring your fingers up. Just copy what I'm doing and tell me, is that more painful? Is that less painful? When does the pain start?
It's sort of here, really, and then it gets quite sharp up to the top there.
And if you go further above your shoulder, tell me what that feels like.
No, it's not too bad there, but it sort of aches down the back.
Okay. And what about up into your neck? If you press it along there, is that painful?
No, not really. It was a little bit sore, but nothing much.
Okay. Now, I'm going to assume that everybody would take a normal case history. You'd ask the questions that you would normally ask. Just because you're on a video, you know, the conversation part of all of this, as far as I'm concerned, is a given. You take your normal case history, you listen to the answers, and for me, it's the assessment, the treatment, and the exercise protocols that's probably more worrying for people. So if your patient has got numbness, get them to touch where it's numb and get them to find the edges of the numbness by touching it. Get them to do the work for you. So, Stephen, now we've talked a little bit about your shoulder, and you said that there's no neck pain. Could you just turn your head to the left-hand side, to one side, and then to the other side? Dear me, you really do need some treatment. And is that painful? Does that aggravate the pain? Does it make it worse?
It does a bit to the left, but it's not too bad to the right.
Okay. And can you show me some movements with your arm? I'd like you to, are you able to stand up and move a bit further away from the camera?
No, I can't. I genuinely, I can't in the studio here at the moment, but
Okay.
obviously it's a possibility in real life, isn't it?
Yeah. So could you just bring your arm up in front of me? And before you do that, what I'm going to ask you to do is to tell me when it starts hurting and whereabouts it starts hurting.
Okay, it starts hurting straight away, round about here, really.
Yeah.
And then it gets really sore about there.
And can you go further, or is that as far as it goes?
Yeah, I can get it there eventually.
Well done, thank you. Okay, so I think the active examination, we all know we can tell our patients to do. So what about for passive examination? Think about what you could do in order to do passive. So Stephen, what I'm going to ask you to do is, can you hold your sore arm with your other hand? So just support it with your hand and just bring that up as far as you can, nice and relaxed with your sore arm. Is that less painful?
Yeah, it is a bit.
Okay, and bring it down. Good. And then could you bring it across your arm? Almost, that's
Across my chest.
Across your chest. Sorry, beg your pardon.
You were never good at anatomy, were you?
No, useless. And then if you could bring it out to the side, keeping it supported with your other arm.
Hang on, I'll just walk around behind myself.
Thank you.
Can I stop for a minute? There's some questions have come in here.
Yeah.
Sasha says, "Hi Steve, thanks for doing this for us." I don't know which Sasha that is, but that's nice of her to say that. But she also says, could we have more information on the UCO webinar? Do you have that, Claire?
Yes. And I have to just point out that Stephen is doing exactly what we just talked about. His picture of me is up to there. His left, which is why he keeps talking.
Yes.
Yeah. What was the question? Oh yeah, UCO webinar. It's been promoted, I think, on the Facebook group Osteopathy Works, and I know that Andy T and Jerry, oh, I can't think of his surname.
Yeah, Draper.
Draper, yeah.
Draper something, yes. Yep.
They've been organising it, but I'm sure
we'll put the link out to people as soon as we discover it after the broadcast, shall we?
Yeah, yeah.
There's a couple of observations here have come in which are really, really good. I mean, Matthew has said that there are quite a few computers where the camera is at the bottom of the screen, not at the top. Macs are particularly good with cameras at the top. My laptop has it in the keyboard, in fact, so putting the picture at the bottom of the screen might be more helpful. And he also points out, and I've seen this on a number of Zoom calls, the person on the other end of Zoom doesn't realize that they've got their screen mirrored. And so if someone says, I've got a pain in my left arm, and you do this, it's very easy for you to think, oh yeah, that's his left arm. But actually, if they've got their screen reversed, you might be looking at the wrong one. And you won't know it unless there's some text in the screen that you can see is back to front.
That's really helpful. I didn't know that was possible.
Yeah.
Okay.
So if you say, where's the pain? And they say here, and you say, well, which arm is that? And they say left. You can correlate those two things at least. And he does say that sometimes with a phone in selfie mode, it laterally reverses the picture. So again, same thing, be careful of that.
And if you're not sure, as he said, get them to stand in front of something that's got writing in it, because then you'll see the writing back to front. Yeah.
Well, they ought to be sure which is their left and their right, shouldn't they?
Well,
if it's not me, that is. Yeah. It says it was Sasha Babbage Clark. Hello, Sasha.
Any more?
Okay. No, that's it for now.
Okay, so So with the assessment, I really think you just have to think about where you want to get to, what do you want to achieve, and then try and work out if it's possible. You can get them. Sadly, I completely forgot to get you to do some acupuncture on yourself, which
I was trying to test my reflexes actually, and they just don't seem to work. It's an iPad.
So yeah, reflexes is obviously out of the question, but you can still do, can you feel this, you know, get them to touch and say, where is this numb?
I think the point that we made a couple of days ago when we talked about this is really important though. If you're asking someone to touch something and test numbness, get them to touch it with an object, not with their finger. Because if you touch it with your finger, you can feel it, unless your finger's numb as well.
Yeah, good point.
And it can be a bit confusing.
Thank you.
Sorry, I'll try not to look at your picture. I'll look at the camera instead.
Thank you. Yeah, exactly. So use the tools, but also make sure you've got those tools ready. So I had to run off and get my weight to get Stephen to do an exercise. If you've got stuff ready, have your toolkit handy, so that whatever they present with, you know you've got the stuff that you need before you get going.
And also to think about the sort of equipment that they would have. They might not have dumbbells, but they could have a bottle of water or, you know, a bag of flour or a tin of beans or something that they can do these things with. So adapt your communication in exactly the same way that you would in clinic.
Yeah. Okay, what else have I got on my list? Equipment not being ready. So obviously I didn't take any notes while we were talking. I think just as we would do in a normal case history, take notes while they're talking and document really carefully, because it's a different format for a lot of us. And we want to know that we can go back to this and feel confident that the notes we took were accurate. One of the things that I thought was really, really good that came up from the UCO training was, if you think your patient might require a referral or might need a referral, but it's not urgent, then document that and say to the patient, I think under normal circumstances, I would recommend that you go to the GP or to A&E. Given the current situation, I'm going to suggest that we do this, this, and this, and reassess you in 2 days' time and then make a decision. Now, obviously, if they've got something that's dangerous, if they've got cauda equina, if their arm's dropping off, that's not going to be appropriate. But if you think they might have RA or polymyalgia rheumatica, and you think blood tests might be what you would normally recommend, say that this is what I would normally recommend, but to the patient and in your notes, so that, again, it's documented that this isn't a normal situation. Can
I have a go?
Sorry?
Can I have a go?
Yeah, sorry, am I talking too much?
No, not at all. I just thought while you collect the thoughts on the other things that you want to say, it occurred to me that both the chiropractic code and the osteopathic practice standards insist that we get consent for treatment. And so you need to record that consent, that the patient is happy that you are doing this via a video call. The GIOSC has definitely said that, you know, they're going to understand that we're operating in strange circumstances, but that doesn't mean that if there's a complaint that it won't have to be answered before they can say this was fine. And what we want to do is everything we can to minimize the chance of you getting yourself in front of the professional conduct committee. Okay,
so other things to think about. When you have done your appointment, when you've gone through what you want, done your assessment, and then what you want them to do for either self-treatment or exercises. And I do think there's loads we can do for self-treatment. You can get them to do passive movements on themselves. So one example is that we had an ankle patient do a telehealth call with us, and he was given stuff to do on his foot and his legs. So he could do soft tissue on the leg and he could do gentle articulation. And I think that you have to use your judgment there. Is this patient capable of understanding the instructions you're giving them? And if they're not, then change what you're doing. But if you think that they will get it, then give them some self-articulatory stuff to do, as well as exercises. And the exercises that we prescribe obviously are going to depend on our individual knowledge of what we know and studied with exercises. But once you've done all of that, go over with them again, reconfirm with them, because remember, this is new for them as well. They're used to being face to face with us and seeing our body language in a very different way. So if you reconfirm with them, so we've gone over this, you're going to do this and this and this, and if you've got questions, you're going to phone me. I'm going to make you an appointment for 2 days' time for me to just give you a call and check how things are going.
Are you going to charge me for that? Are you going to charge me for that?
I think this is something that's really difficult for everybody at the moment. Nobody seems to know whether, if we charge for patients, whether people who are self-employed will be penalised for that. So until there's clarity about that, I don't really know how to answer the question. We've set up in our clinic, we set up 3 appointments that we charge for. One's 15 minutes, one's 20 minutes, and one's half an hour. I'm assuming the half-hour ones will only be for new patients. I've also set up, I think, 3 free ones. One's a free catch-up chat.
Which is what I was referring to just now. That's what you're doing, that two days' time, I'm going to call you and just check everything's okay. Yeah? Yeah.
We've also got one 15-minute appointment that's free, and we always do offer a free 20-minute consultation to new people, so I've kept that. That free 15-minute appointment, that's a proper appointment. In all of the stuff that we've done, I've said to people, we understand that lots of people have been made redundant. We understand that lots of people are having problems financially at the moment. If you're one of those, have this appointment. And I like to think that most people wouldn't take the piss with that. And if they do, well, you've still interacted with somebody who thinks you're important and needs your help.
A couple of points that come in, Claire, if I may.
Yeah.
Robin's asked a couple of things. Robin Moody, he said, first of all, are we happy with Zoom as a platform? I think personally Zoom is one of the best video conferencing platforms around, but that means it's really good for multiple participants, not just one-on-one. There are other platforms. The only one that we felt the other day when we talked about this, which was not secure enough, was FaceTime. But frankly, I honestly think that the security risk on the platforms is so minimal as to be not worthwhile, not worth worrying about. But Zoom is definitely a very, very good platform, and there is a significantly capable free option in the Zoom membership. So you can take your pick. The other ones would be what you could use Skype, other things, Claire? WhatsApp, of course, yeah, WhatsApp. And WhatsApp has famously good encryption. People have said that the people who administer the platform can access the videos, but again, I would suggest we're not going to be doing anything which is particularly invasive in these. We're not going to be asking people to undress particularly far, are we? So there's nothing that's going to be desperately revealing going out on the video.
I think that depends, though. I mean, if somebody comes in with an acute SI type problem, you're probably going to want to ask them if it's okay to look at the area, because you don't want to discover 2 weeks down the line that they had a whopping great bruise on it. Yeah. Or a big lump or something. Yeah. But I think it really depends on the practitioner. And I think that's one of the most important things with these video calls, is that you don't have to follow a protocol that somebody else has set up. You can do these the way you want. You can charge what you want. And if it's not normal for you to give lots of exercises and you don't feel comfortable giving exercises, it's fine just to phone people and check they're okay. I think the culture of our clinic is that we are predominantly very, very hands-on. So I think we probably won't have many follow-up appointments or new appointments that we turn into a paid. Sorry, go on. No,
it's all right. Robin did ask about fee structures, which you covered a moment ago. And it occurs to me that one option with those is that if you're seeing patients, clearly if they've got no income and no prospect of getting any income, then you can take a view on that. but actually many employed people will be getting their salary just as they did normally, even if it's only 80% of their salary. And you can say, well, look, have you had it yet? If not, well, I'll put this on account. And when you get that salary paid back to you in due course, you can settle up if you can. And patients are going to understand that. There's no reason why you as a practitioner should suffer while actually your patients aren't really taking a financial hit, because they will get their pay. And I'm not saying we want to be cruel to them or charge the same fees as we would for a hands-on appointment, because we do a lot more in those appointments. But it's okay to charge, especially if you understand the circumstances, you accommodate the circumstances of the patients concerned.
Yeah.
The other thing, Sasha sent in a follow-up on recording. The IO has said don't record these conversations. Now, I understand why they would say that, but at the same time, I would say if you felt there was a need to do it for your own protection afterwards or whatever, as long as the patient is aware of it, there's no reason not to. I think you'd have to explain to the patient, where is the recording going to be stored, who will have access to it, how is it going to be kept private, and that may present you with more problems than you want to address. But I don't think that there is a blanket ban on not having a recording of the conversation, not least because we will want to protect ourselves in the future against any allegations that we did something improper, in the sense of gave bad advice or didn't do a proper examination because it was a remote consultation. I would err on the side of not recording, definitely, but if you felt there was a need, I don't think that's outside the scope of your insurance or anything else, and I don't think it will land you in any danger with the authorities, as it were.
The only thing I'd say about that is that we don't record our normal appointments, and we, any cases that come up.
Absolutely.
Any problems with them are based on the documentation we've got. So if you're documenting well, then there shouldn't be any need to record. Perhaps
there's an even greater need to record very, very accurately what we said and did in our appointments if we're doing it by video link, just to make sure that there can be no disputes afterwards. Marina has sent in an observation that Clinico are now providing telehealth options as part of their package, and Jane is doing it as well. Any idea who else is doing it, Claire?
No, I haven't seen any of the other software packages making it available. I think Clinico goes live this week.
Okay. Silva, we know from many of our courses and is a long-time member, so great to hear from you, Silva. She said that she recorded the Chancellor's announcement and listened to it a few times, and she understands that the self-employed can work while also waiting for government payment when we get to June, when they pay people back. So that's some reassurance that we can carry on doing this stuff and still expect some support from the Chancellor.
It's interesting what you said about there will be some people who are still able to pay. And I remember seeing somewhere, probably on Facebook, that somebody's patient had said to them their appointment was cancelled, and the patient said, I am still going to be working or earning money. I would like to pay you for this appointment now, so you're not left without cash, and you can treat me at a later date. So you're absolutely right. It's important to remember that there are people out there who will be in a better position than a lot of us, and who won't mind paying for their appointments, whether it be a video record appointment or one that they're not keeping at the moment.
We've got 5 minutes left, Claire. Do you have
so
more to run through?
Yes, yeah, a really, really important part. So after you have confirmed what you've agreed with the patient, what you've said to them, what you've advised them to do, what happens next? How do you close that call? Because ordinarily, when you're face-to-face, you have a bit of that, oh, have a nice time, be good, behave yourself, make sure you do exercises. And there's this kind of to and fro banter that we have with our patients. When you click the red button on Zoom or on any of the softwares, it stops instantly. So what the UCO have really cleverly recommended is that you explain to the patient that that's going to happen. And you say, okay, so I think we've covered everything. I'm now going to click the big red button and I'll speak to you in 2 days' time. Bye for now. And then you click the big red button and you don't do the bye, 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 bye. toing and froing. You just click the big red button. But if you don't tell them that that's what's going to happen and that it's going to be quite an abrupt ending, especially for somebody who's not maybe done a video call before, it's a bit disconcerting. Okay. So there you go. That's my thinking about them.
Okay. Perhaps the last observation that we'll get coming in this afternoon, someone sent in that Rehab My Patient also has a telehealth option. Oh, yeah. And of course, you know more about that, Claire, because obviously we use Rehab My Patient in our clinic, but we don't do our clinic notes through it. So,
yeah, and because Jane that we use for our diary has set up the video calls, we've done all of our training on that. So I haven't looked at Rehab My Patient, but when we've used Rehab My Patient for our normal stuff in the clinic, for exercise prescribing, for their pictures, their videos and what have you, it's always been very good. And I know that it's run by somebody who's quite driven to keep it good. So I would anticipate that they set something up that's nice. So if you use Rehab My Patient, definitely check it out.
Yeah. Okay. I've got no more questions that have come in. So if you're done on that, Claire, then we'll close for this lunchtime.
One more thing.
Oh, sorry, go on.
And that is...
You always have to have the last word, don't you?
Oh, yeah, yeah. We have all been doing this for years and years and years. We have been giving our parents advice over the phone. More recently, we've been giving our siblings and our mates advice, and we've watched them do this and say, oh, it's my wrist, and poke their arm out beyond the screen picture. So don't feel that this is new for you. You know how to do this. You know what your remit is. You know when you're safe. You know when you're not safe. It doesn't matter if you don't do any of them, but if you're going to do them, just trust that you've got the brain to think outside of the box. You know what you're doing, and you've done it a load of times before. It's just you didn't realise it. I'll shut up now. Good.
Claire, thanks very much. I mean, that's a lot of useful information. It was a lovely recap on what the UCO have said in their webinar, and we will put the link out, send the link out to everybody for that as well, and we'll put it on the website. And for me, the key elements of this are not to get confused or scared by the idea of doing a telehealth consultation, because as Claire said, it is just talking to people over a different medium. And the other thing is not to get worried or scared that you're going to fall foul of the law, because the Information Commissioner's Office said it's perfectly okay to do video or telephone medical consultations. You don't fall foul of the Data Protection Act. And the IO has said, and the General Osteopathic Council and GCC have said, you know, they're expecting us to do these consultations. And they've certainly said that they understand that things won't be normal, and so they won't be holding us to account if we can't do all the same tests that we would have done before. What they understand is that we are looking after patients, that you're looking after patients. And a final point perhaps is what several people said on a broadcast 2 days ago: never underestimate the power of a kind word. Sometimes it's just nice to have someone talk to you and reassure you that that back pain isn't about to kill you. So just don't be scared of talking to your patients. The fee structure is up to you, but just remember that some of them have got money and you are worth it, because you've got this medical expertise that you can share with them to reassure them and point them in the right direction.